Let's just check in with hospitals in KwaZulu-Natal. Not only are they dealing with COVID-19 cases, as we've seen, but also, of course, issues around the violence that we've seen. You saw the acting minister in the presidency speaking just a moment ago. Let's speak to the Progressive Health Forum's Dr. Aslam Dasoo. Dr. Dasoo, good evening to you. Thank you for your time. I mean, it must just be the most incredible strain that KwaZulu-Natal health facilities are now under.
Good afternoon, Stephen. Yes, certainly. I think there's been a huge impact just from the pandemic. And now that the violence has erupted, of course, a number of people were injured and would need care. And so all the excess beds have been taken up. So the KwaZulu-Natal Department of Health is facing a severe crisis. Not only are the beds short and staff overworked, but there's also a concern about food supply. And to those hospitals, as you can understand, those are big catering projects, and they've all been disrupted. So the health system is facing a huge threat right now.
I mean, one of the things we have now, of course, is that we saw some super spreading events just before this violence, before this looting. We all remember what happened at Nkandla and an incident before that. But now we've had really a week in Gauteng and in KZN of people moving around almost as if the lockdown regulations didn't exist, many not wearing face masks. There are going to be huge fears that the virus is going to spread more than we've ever seen, just as we have the most transmissible variant there is.
Quite correct. Look, pandemics pronounce underlying schisms in society. So it's not surprising, certainly to many of us, that there was such an upheaval. And the instigators have to be careful about what they wish for here. I don't think they expected the upheavals to be as large as they were, but these upheavals are going to lead, as you said, to super spreading events. And the virus is non-discriminatory. It will consume the instigators as well. We are going to see the consequences of this super spreading events coming through in the next week or 10 days. One hopes that the health systems will be sufficiently reinforced to meet that, because there are going to be a huge number of hospitalizations from COVID and a large number of deaths from it as well. And the resulting state of lawlessness right now in the province is not helping at all, because, as you said, people are not adhering to lockdown regulations. I think all in all, both the upheavals and the response to it has been shockingly bad. Especially, it's almost as though people didn't factor in that we're in the middle of a pandemic while all of this is going on, especially the authorities. And I mean, there were lots of calls for a state of emergency and so on, but moving simply to level 5 might have mitigated quite a bit of this. But for some reason, that wasn't even considered. Instead, they've published regulations that will allow politicians and religious leaders to create gatherings, ostensibly to reduce the tensions in society. Well, they may, but I can assure you they will increase the rate of transmission as a result. So the people who are planning all of this need to think again about what they're doing. We have lost 80 to 100,000 vaccination appointments just as a result of this. We have lost the capability of people with HIV, up to 300,000 of them, to come in for their meds and their ongoing treatment. So the knock-on effects of all of this is quite astounding. The private sector vaccination sites that have been demolished will take a long time to come back on stream. The public sector will try and do its best, we understand, to expand their own vaccination sites, which were fortunately spared from much of the violence. But that's not going to make up for things quickly. We can expect the consequences of these upheavals to manifest very strongly in the next 7 to 10 days.
Dr. Aslam Dasoo from the Progressive Health Forum, I do appreciate the time. Thank you.